This afternoon, 10 on Your Side brings you a special coronavirus digital discussion about the pandemic. We have them on most Monday afternoons beginning at 1:15. Today, we are talking about some brand new results from a special COVIDsmart research project that Eastern Virginia Medical School is working on. They're looking at how the pandemic is affecting all of us, and some initial reports are saying that our mental health is not good. I'm joined this afternoon by Dr. Sunita Dodani, the principal investigator for this COVIDsmart project. Dr. Dodani, thank you so much for your time.
Thank you, Stephanie, for inviting. Pleasure to be here.
Well, we have talked about mental health throughout this pandemic, so it may be no surprise to folks that we are suffering. But the initial results from your project show, I think, that we may be suffering more than most people think. What are you discovering?
So, Stephanie, the results that we have shown in less than a month are several. Number one, as if you recall, Stephanie, we started this COVIDsmart study on March 5th. And in less than 4 weeks, over 450 participants have contributed to the study and have completed the survey and have provided the data. So we went ahead, we analyzed the data on 450 participants, and shockingly, we found that anxiety, moderate to severe, is 23%, and depression is 24%, moderate to severe. So, Stephanie, these numbers are shocking because if we look at the presence or prevalence of anxiety and depression, moderate to severe, pre-COVID, these are around 6 to 7%. So 3 times increase during the COVID pandemic.
Wow. And Dr. Dodani, for folks who are just joining us, we wanted to let you know, because of our audio system, that's why the doctor is holding the phone here to talk to you today. So let me go on. You said 450 people have taken part in this survey. Are you getting a vast array of people, or are you seeing one demographic more than another? And if so, does this affect perhaps what you're seeing?
This study, Stephanie, is for Virginia. It's a statewide study. So what you see, these numbers, these are coming from diverse population, not just Hampton Roads, not just the Northern Virginia, but also, all over the place. So we have the data also on, on how many numbers are from Northern Virginia, how many are from Southern Virginia, so on and so forth. But numbers are not different from any region of Virginia.
Okay. I understand that you're getting a response, though, from a lot of women. Is this true?
That is very true. Majority are women. That is correct.
And so does that play into, do you think, what you're hearing? Do you think that women might be more susceptible to these symptoms than men, or is it just because we're only hearing from women at this point?
It can be both, Stephanie, and that is something what we have to kind of investigate further and develop more questions and in-depth surveys. Women are 70% of the population, this 450 population are women. So either they are suffering the most, and that's why they are participating in the study, or it's just that women are participating more in general than men.
And when you say they're experiencing these symptoms of depression and anxiety, what specifically are they telling you? Are they actually going to seek medical treatment, or is this something that they're suffering at home?
So the diagnosis of new cases of anxiety and depression, Stephanie, are based on validated questions. For example, in our survey, as you know, that there are more than 200 questions. We have asked questions like feeling tired or having little energy, feeling issues with going to bed, increased alcohol consumption, and mood swings, mood changes. Do you feel hopeless? Do you feel that you don't want to talk to your family? So those questions, when we summarized all those questions, we scored them. That's where these numbers are coming from: 23% of severe to moderate anxiety and 24% of moderate to severe depression.
So these numbers are staggering and depressing in and of themselves. So what can you do with this type of information? Where do you take this? How will this be used to help folks?
So this is going to help us develop individually tailored interventions for these populations, Stephanie. There are many programs that are offered through telehealth And there are programs that are modeled around cognitive behavior therapy. So one of such program is Silver Cloud. This is a program, it's an app which is offered through cell phone. It consists of 12 weeks, 8 to 12 week sessions on improving the behavior, improving the lifestyle, and so on and so forth. So we are exploring funding opportunities so that we can offer these kind of program to these newly diagnosed patients.
And will this be used at all to help create new programs or for use by hospitals or lawmakers when we're looking at hiring more doctors or building more mental health hospitals?
Absolutely. This is just an eye opener, Stephanie. The numbers are, as we all know, the study has provided just the tip of the iceberg. There are more numbers. So certainly these call for, improving the current policies, increasing the number of psychologists, psychiatrists, providing training to family physicians, increasing the number of family physicians who can, handle this increasing burden of mental health in our state.
Now, this COVIDsmart project is ongoing. Is it too late for folks to enroll? Do you need more people to enroll to get a broader sense of what's happening?
Not at all. This is the time. We do need more data. Our goal is to have at least 2,000 participants, to have more generalized numbers. So we really encourage everyone, somebody who's an adult 18 plus age, who lives in Virginia, provides an e-consent through our website, which is covidsmartstudy.org. Please participate. Tell us your point of view, how COVID has impacted, because that will kind of provide us the evidence, the need of more mental health programs in our state.
Excellent. So once I go on to your website there, what can I expect? What kind of a commitment is this?
It's like there are surveys. We are collecting at 3 points. One is the baseline. Then the second one is after 2 months to see the follow-up, and then at 6 months.
Okay, and what kinds of questions will you be asking besides the ones that you've already indicated about if you are not interacting with family or tired, things like that? What other kinds of questions am I going to be asked?
So there are general questions about health also, any other health issues, heart disease, obesity, diabetes. So general health, then questions on COVID vaccine. So these are the questions that we added because the vaccine is nowadays offered to everybody. There are questions on somebody who has got COVID, how they feel about COVID complications. So it is a very comprehensive study, Stephanie, not just covering the mental health. The reason why we presented mental health, because the information that we got was very, staggering. It was an eye-opener. That's what we have presented. We have not yet analyzed the data on other comorbidities, which we are going to do soon.
And we'll be doing this, of course, over the next year and beyond, I'm sure, as you are continuing to follow up with people. What do you expect to see as you continue on following up with folks?
So we are hoping that we will continue the study because everything is dependent on the funding. If we get more funding, we'll definitely hope to kind of get a fuller picture of the health status of Virginians. That this will help us develop, programs, not just on mental health, Stephanie, but also on other conditions.
I want to go back to the beginning just for a minute, and you just mentioned the mental health is just the first piece that you all have kind of pulled out of this study. A little bit surprising to me, even though I've been reporting for over a year now about how it's been affecting our mental health, the numbers were a little bit surprising. Did they surprise you?
Yes, indeed. Absolutely.
And what about it surprised you? Did you think it would be, double, not triple, or what were you expecting to see?
So honestly speaking, we were thinking that numbers have increased. That was not a surprise. But the numbers are going to be 3 times higher than the pre-COVID time. That is what surprised us. Yeah. So that was really kind of shocking for us.
And we already know that in our whole country, not just in Virginia, but we are really short on mental health physicians and healthcare
Yes.
workers in general. So what is this saying to you or screaming to you about the next few years or decade ahead as we try to help people climb out of this?
Certainly, Stephanie, this study, I mean, this is just a small study, but it has a huge impact. I mean, it talks about that how important are mental health issues and basically kind of point towards that we need more services, we need more eyes on looking at patients' mental health also in addition to other healthcare problems. This is just an eye opener.
And so I guess where do we go to try to help people? If you are trying to get an appointment, I know I've heard from so many people, even before the pandemic, who have tried to get an appointment for mental health and they're on a waiting list for such a long time. What do you suggest that folks do if they're suffering or if a loved one is suffering?
So the first point of contact, Stephanie, is their family physicians. I mean, that is where they go. The first thing, they should kind of, when they are suffering, anybody who is having issues with, sleep, with, feeling of, losing hope, feeling of losing, appetite and not enjoying life. I mean, these are some of the signs and symptoms of anxiety and depression. That is the point that if I have to advise people in our state, if they are suffering from any of these symptoms, the first point of contact is your primary care physician who will assess your health.
Sure, there's always emergency help if you are in desperate need. So
Exactly.
I know you're going to be studying this, following people for at least 6 months, but how long do you think, years, months, we'll feel the ramifications from the COVID pandemic, even if you didn't have COVID?
So mental health issues take time to improve, as we all know. It is not like a somatic condition. It's not like you've got an infection that will completely be fine in several months. So it takes time. So that's where, these different modalities that I talked about that are based on cognitive behavior therapy, they improve the behavior that involves the family members also. So it will take time, Stephanie, to improve anxiety, to improve depression. And it requires a coordinated effort, not just the doctor, but also the family, the peers, social workers.
All right, Dr. Dodani, thank you so much. We appreciate your time today and for all this work that you're doing in our community to try to help us all get healthier and through this pandemic. We appreciate it.
Thank you very much. Thank you for inviting.
And I thank you all for joining us this afternoon as well. You can catch more of our discussion coming up later tonight on WAVY News 10 beginning at 4. Have a good afternoon.